After reviewing the patient's medical history, we will begin the extraoral exam. By doing this, I will look at the patient's face to determine the color, consistency, and function. By looking at the color, we want to make sure that there are no color variations in the skin. We want to make sure that there are no raised parts by variation. And we want to make sure that by no color variations or consistency variations, that means that function will be well. Next, I'll have the patient raise forward while I feel the occipital lobes on the back of his neck. You're going to be feeling for bony enlargements. If you feel any, that means you need to report it. And their review, have the patient tilt backwards, where you feel the submental and submandibular nodes. You want to feel for bony enlargements here too. And if you find any bony enlargements, you also need to make sure you record that. Next, I'll have the patient put his tongue to the top of his mouth, and this will allow for palpation of the submandibular gland, which is right below the submental. You're going to be feeling for any lumps or any types of enlargements in the gland. It should feel soft and squishy. If not, then you need to report otherwise. Next, I'm going to feel for the lymph nodes in the neck. Just palpate over the patient's neck, applying not firm pressure, but pressure. Next, I'll have the patient sit up straight, and I'll have him clench his teeth together while I feel for the parotid. And while the patient clenches, it allows for easier palpation of the parotid gland. It kind of makes it stick out. Next, I'll have the patient open and then slowly close while you put your fingers right in front of the ear to where you can feel the TMJ. So open, close slowly, open, close slowly. You want to feel for any popping. If you feel popping or kind of like a almost a locking feeling, you need to report that because that could lead to further complications for the patient. Next, I'm going to be feeling the pre and post auricular nodes. You're just going to apply a little bit of pressure in front of the ear and then come behind the ear and feel. You're just feeling the lymph nodes and feeling for lumps or abnormal hardness. Okay, next I'll have the patient turn his head and lower his chin a little bit, and this is going to allow you to palpate the sternocleidomastoid muscle. You just want to make sure that the muscle is tense and that there is no weakness feeling to the muscle. You want to do this on both sides and be sure that you compare the right and the left. And while you're already here, just go ahead and feel the anterior and posterior lymph nodes. Make sure you feel no lumps or enlargements or any hard spots within the lymph nodes. If you find any, you need to report them. They could be a sign of illness. Next, I'm going to be behind the patient and I'm going to feel for the thyroid gland. By doing this, you're going to slightly, just very slightly, move the trachea. Not too much because it'll hurt the patient. So you just want to press enough to where you can feel the thyroid gland and to make sure that there are no abnormalities. And then lastly, you're going to come in front of the patient, and you can either give the patient a liquid to swallow or you can just swallow saliva. And you're going to have him swallow more than once while you feel behind the trachea and just feel for any difficulties in swallowing. And that's all.